Adjusting hormone therapy doses is one of the most critical steps in ensuring optimal treatment outcomes. Every patient is unique and their response to hormone therapy can vary based on factors like metabolism, age, and lifestyle. By closely monitoring their progress and making thoughtful adjustments, we can achieve the right balance, delivering effective results while minimizing side effects. In this part, we will talk about how to adjust hormone doses based on patients' responses and feedback. Why the dose adjustments are so important. If we want to look into the reasons for that, first of all, we need to consider that the individual responses to therapy vary widely. So adjustments are essential to meet each patient's needs. Secondly, patient feedback is invaluable. It helps us fine-tune dosages based on real-world results. And thirdly, the ultimate goal is achieving balance, delivering effective outcomes with minimal side effects. Let's talk about these in details. The first step is deciding on dosage adjustments is evaluating key factors that influence hormone absorption and effectiveness. These include age, weight, metabolism, and lifestyle. For example, a younger patient with a high metabolic rate might require a different dose than an older patient with slower metabolism. Similarly, lifestyle factors like diet, exercise, and stress levels can significantly impact how hormones are processed in the body. A patient-centered approach ensures that these variables are taken into account. So when should we consider adjusting dosages? There are three main scenarios. First, if symptoms persist despite the current treatment regimen, it suggests that the dose might not be enough and needs to be increased. Second, if new side effects arise, like mood swings, fatigue, or skin changes, it might indicate that the dose is too high or needs to be delivered differently. And third, if patients report ongoing issues like inconsistent energy levels or changes in weight, a dosage review might be needed. Lab results play a crucial role in guiding these adjustments. Regular testing allows us to interpret hormone levels, monitor key markers, and tailor dosages to optimal ranges. For example, if a patient's testosterone levels are within the reference range, but their symptoms suggest a deficiency, we might adjust their dose slightly to target an optimal range. Using lab data alongside patient feedback ensures that our decisions are both evidence-based and personalized. When adjusting doses, it's essential to take a gradual approach. Small changes are safer and allow the body to adapt without sudden hormonal shifts. For example, increasing or decreasing a dose in small increments over several weeks gives us time to monitor the patient's response and ensure stability. During this process, managing patient expectations is key. Explaining the reasons for gradual changes builds trust and improves adherence of patient. Addressing side effects is another important aspect of dose adjustments. Common side effects like headaches, weight fluctuations, or changes in moods can often be mitigated by lowering the dose or modifying the delivery method. Continuous monitoring helps us identify patterns and make further adjustments if needed. The goal is always to minimize unwanted symptoms while maintaining the effectiveness of the therapy. Involving patients in the adjustment process is essential for long-term success. Start by educating them on why adjustments are needed and how these changes will benefit their health. Encouraging feedback about symptoms and side effects ensures that they feel they are heard and involved in the process of their care. This collaboration not only boosts satisfaction, but also improves adherence to the treatment plan. Keeping accurate record is another cornerstone of effective dose management. Documenting every adjustment along with the rationale behind that, patient response to that, and any side effects ensures a continuity of care. This is especially important for practices with multiple practitioners or patients who may move between providers. Thorough records also make it easier to track long-term progress and refine therapy as needed.